Good morning and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian, a licensed marriage and family therapist and a certified sexologist in full-time private practice located in beautiful sunny Encino, California. And I'm here this morning along with my best friend, my colleague, and my business partner, Dr. Robert Jaffe.
Thank you, Dr. Rashidian.
Hi, you're welcome.
We are here today to talk about addictions, codependency, relationships, and trauma. We've been talking about this for a number of months, and so we want to welcome everybody. We're here to share with you some of what we've learned over many years of study and practice about these topics. And the goal, of course, is to help you to feel more loving and joyful every day of your life. We are born into the world as our loving, authentic, true self, and we come in with a lot of great qualities. Let's see, what are some of the qualities? We come in open, we come in curious, we come in honest. Yes, we're all honest when we come in. We don't know how to lie yet. And we come in sexual. We're all sexual beings when we come in. And we all come in trusting that the world will be a good place for us. And when we get nurtured, when those qualities get nurtured, we turn out to be happy, joyous human beings. And when those qualities don't get noticed or nurtured, some negative things happen, and then we have to seek recovery later in life. And that's what we hear. That's what we're here to do, is help people recover. We're doing that through our radio shows. We're doing that through our other means of communication, and we do that through our private practice. So here we are.
Here we are. Yes. And I'd like to, invite you to please call us this morning and share your thoughts, your ideas, your findings, what you're concerned about. At 951-922-3532. And also you can visit us at our YouTube at heart-to-heart.online/YouTube. So, Dr. Jaffe.
Yes. So today we're going to be talking about the process of healing. We've been talking a lot about where addictions originate. We've talked about that quite a bit. And basically, in a short paragraph, most addictions come from dysfunctional family systems, where you're trying to pull me in closer.
Yeah, I mean, we were not adjusted on the screen.
Okay.
Yeah.
So most addictions come from dysfunctional family systems, where the parents don't know how to nurture the children, and often the parents give negative messages to the children, and these negative messages create within the child a lot of anxiety.
Right. So I like to kind of shed light on that negative messages.
Mm-hmm.
It's not that parents intentionally want to give negative messages, right?
Correct.
It's just parents are giving to the child the messages that they themselves have lived with, and they believe that's the reality of life.
Correct.
Right. That's why, parents, have, obviously, most of the time or sometime or at times, not a perfect image of, not the perfect messages for children, right?
Mm-hmm.
Parents have lived with those ideas for years, for a lifetime. And, they believe that it has worked for them. So they just pass it on to their children. However, when the children receive that, and due to the differences between their false self and then the false self that is, shaped because of these negative messages and because of the unhealthy attachment that they form with their parents, right? Once the children kind of put their true self in their hiding and function based on their false self, that discomforts, it's an indication of receiving negative messages.
Say that last thing again about the comfort. You said
when we say parents are giving negative messages to children,
yes,
right?
Yes.
The way it comes across, is that parents are there to just give negative messages. But most parents, they're not even aware that the messages that they're giving to children as part of their learning process, they are actually negative.
Correct.
Right?
That's right.
So because children are so dependent on their children, on their parents, right? They assume that any message that the parent is giving to them is the right one.
Right.
So they adapt to that. They accept that.
Exactly.
They live with that.
Yes.
Right?
Yes.
And only to realize that there is a struggle, inner struggle with themselves. And that inner struggle is because those messages, they don't truly connect to the child, because those are, they're not their experiences. Right? We all have a true self, and we all shape into a false self. Right?
Well, no, not all of us.
Well,
no,
okay, many of us.
Well, no, we're not
many,
all.
Many of us.
No. What we're talking about is in a healthy family, you don't acquire a false self.
Yes, in a healthy family, but
yes.
For the families who are giving negative messages, that's not a healthy family.
Correct. Right.
So when we all come in with a true self, like you said it in the introduction, right? And we say it all the time, right? But because of our dependency to our parents, our caregivers, we kind of push back that true self and we adapt into what they want us to be.
Well, we will do that if we need to do that.
Well, most children need to do that.
No. I mean, we will push aside our true self or our true feelings about things if we need to do that in order to fit in with the family.
Right.
But if the parents give the child the message that I want to understand and I want to hear your true feelings, then the child doesn't need to do that.
Exactly, but that's a healthy.
In a healthy family.
Right. But those negative messages, many times, they are not even known to the parents to be negative. Because
the parents were parented by parents.
Exactly.
And their parents were parented by parents.
Right. It's like sort of a chain of command,
Yeah. So,
right.
Yeah, so we're not trying to say certainly that your parents didn't love you. They actually may not have. Which is a surprise to a lot of people. They think, well, automatically parents love their children. Not always, but in many cases, the parents do love the child and are trying to do the best for the child. But the parent can only give what they have inside of them.
Yes.
Yes.
Right.
And so, we talked a lot about the origin of addiction, which is carrying emotional pain inside and not knowing what to do with it. And so the emotional pain means the loss of your authentic true self. And it means being given messages that are contrary to who you really are. You're just a brat. You're just like your father. You'll never amount to anything. Shut up. What makes you think you have something worthy to say? These kind of messages. And of course, the child, as you said, being dependent, needs to obey. But they obey, and inside of them, they're feeling misused. They're feeling upset. They're feeling sad. They're feeling unheard. And of course, they're feeling angry.
And also, I like to add to this some of the positive, negative messages that we also give to our children.
The positive, negative.
Right.
Okay.
So what are the positive, negative? Oh, you look so great in that, outfit that you're wearing. Right? So what's the negative part of that? It's a positive message. The negative is that we're teaching the child that, they're looking good, they're looking great, they're being good. It's dependent on the external factors. Oh, you're such a tough boy. Oh, good job, great. So we're teaching the child that they need to be tough in order to be great.
In other words, to be careful of what the things that we focus on,
Right.
even if we think we're giving a compliment,
Right.
because basically we're also saying you need that, whatever that is, in order to be okay with me, or in order to be okay, period.
Yes, that's why, the girls, they very early on, they learn that they need to put this bow on their hair for their hair to look pretty. Soon they need to learn, they need to wear pink in order to look, girly and pretty.
Right.
Right. And then we're wondering that why girls, are looking for, makeup so much, or for looking great, looking that way, looking this way, in order to feel good. And then when during their teen years, or their early adulthood, when they want to go on a date and all of that, they go out of their way to look good. Right? But boys don't do that. Right? Boys instead, they act like, they are in charge, they are so we know how they are, right? So these are all how we positively, negatively shaping our, children to believe that they need to be certain, they need to look in a certain way and be in a certain way in order to be good.
Right. Exactly. So what in order to recover from coming from a dysfunctional family, and recovery meaning that you are recovering your authentic true self, and you're beginning to dismantle and disconnect from your false self. In order to recover, there are a lot of blocks that people run into that keep them from full recovery. People now, this show is about addictions, and we have said before, and we're saying now, that codependency is the most common addiction, and it's also something that people don't recognize as an addiction.
Right.
So they call it codependency, but it's actually a form of addiction, because what codependency means is I can't trust my authentic true self. I can't trust my own feelings to give me good information. And why is that? It's because of what you were just talking about. It's because we had to conform to our parents' idea of what was right and what wasn't right.
Exactly.
And that wasn't necessarily true for us. So we then look for something outside of us to give us validation, to make us feel good. And the things that we look for in some people are drugs and alcohol. For some people, it's sex. Sex validates me. It makes me feel important. For some people, it's gambling. For some people, it's cigarettes. And for some people, it's food.
So we just got this signal that our commercial break is coming up. And, I'm looking forward to hear your discussion about this after our commercial break.
We will see you soon.
See you soon.
Bye-bye.
Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM ABC News Radio. Dr. Mitra and Dr. Robert here. We're talking about codependency as a form of addictions and impacting our lives, relationships, and how trauma can contribute to this situation. It's a lifelong, pervasive process, and many people who are suffering from codependency, they don't even know they have it, and then they don't know also that it is a form of addictions. And please call us, share your experiences with us, 951-922-3532. And please introduce this program to those that you believe they can benefit from. And we thank you for giving us your hour here this morning on Friday. So Dr. Jaffe, you were talking about?
I was talking about how codependency is the largest addiction, the most pervasive addiction. I was saying that other forms of addiction, drugs and alcohol, food, sex, gambling, cigarettes, those kinds of addictions are pretty well known today as addictive things. But what isn't known so much is the idea that we can be addicted to another person, and we put that person ahead of us in terms of how we feel about ourselves.
I think that's a very good, good point that we can explore a little bit. Is that I believe that one of the reasons we consider alcohol and drugs and, for example, gambling or sex addiction, these are some of the very obvious and notable addictions that we know of, right? It's because they are tangible. It's because we actually use something to,
to feel better.
Right? What we don't realize is that, codependency is not tangible.
Right.
That's why we don't feel that, it is an addiction, and actually how we're doing it. Right? What do you think?
I think you're right. I think it's much more, those other addictions are much more obvious.
Yes.
Yes, so we can see them and we can label them more easily.
Right.
But codependency is about relationships.
Right.
And so in a relationship, when you're codependent with somebody, that means that you value their view of things more than your own. So what does that mean? That means that if the person says, honey, I really didn't appreciate your telling the Joneses, that our daughter was struggling in school, and so then the honey will go, well, I thought you would want to do that. I thought you would want me to talk about that. And what's wrong with what I did? I think I did something okay. And why are you complaining about that? The last time we talked, you talked about how you were struggling, and so why is that person getting defensive, right? Why isn't that person just accepting, okay, you didn't like that you were talking about that? Because that person who is saying, I didn't like it, is making a negative comment about you. You're taking it personally as though you're not okay. So they are now defining you in your own mind as not okay. And you accept that definition, and part of you says, well, that I don't like that definition, so I now have to fight against that definition, as though that person, number one, was defining you, and as though their words matter more than how you feel about yourself, right? So I depend on you to tell me whether I'm okay or not. And so what we have in relationships then is we have reactivity rather than responsiveness. And the reactivity is because I'm looking to you to define whether I'm okay or not. Tell me I'm okay today. Tell me you love me today. Tell me that you're attracted to me. And if in the past you have given me a compliment and you said, gee, I really like the way you look, and today you're not giving me that compliment, why aren't you giving it to me today? And so I'm listening with an ear towards judgment. And that's basically a lot of what negative programming from our childhood is about, right? It's about negative judgment. And so we become very sensitive to other people's judgment, especially to the people that we're close to. And when those people judge us, or we believe that they're judging us, they don't even actually have to be, but we feel as though they're judging us, we feel defensive, and we feel unhappy, and our mood changes. And so we're dependent on the other person's goodwill to make us feel okay, just as a young child is dependent on the parent's goodwill in order to make them feel okay.
And that is so important to, to recognize that we are not defined by somebody else, by somebody else's, definition of us.
I am not what other people think of me.
I am not what other people think of me,
Mm-hmm.
right? However, when our parents raise us that way, and then those early messages, they are like glued, in our brain. They become, those are how our neurons and synapses are shaped.
Right.
That we believe we need to be, told who we are or how we are welcome in life, and then we just follow that path until we recognize that that's not the right path.
If we ever do.
If we ever do, yes.
Yeah. Because many people struggle with codependency and never come out of it. So they're always in a relationship, and it can be, they can go from relationship to relationship, or they can stay with one person, but in that relationship, they're not their authentic true self, because they're afraid if they disagree, or they're afraid if the other person isn't feeling loving toward them at any given moment, that defines who they are. Yeah. So codependency, just like all the addictions, needs to be dealt with in a methodical way. We have to understand. Now, one way of looking at it is addiction and codependency are difficulty with emotional maturity. When we are emotionally mature, that means that we understand that other people are simply giving us what their thoughts are, but that their thoughts are not more valid than our thoughts, and that we actually value our thoughts the highest. That doesn't mean that we discount the other person's thoughts. We take it into consideration, but we don't automatically assume that their thoughts are better than our thoughts. And so in order to recover from codependency or addiction, we have to emotionally grow up. And that's what recovery is about. That's what, when people go into a 12-step program, for example, like Alcoholics Anonymous or Narcotics Anonymous, part of what they get is a safe place where they can express what's going on without fear of judgment. And so they can walk into the meeting, and they will listen to other people. And even though internally they may have a lot of thoughts and feelings about it, externally they're not going to be judging them. So the person who's sharing gets to feel safe. And then if they do comment on what the other person is saying, what they try to do is relate to the other person. And what judgment does, of course, is judgment puts us in a one-up position from the other person, as though we know better. Right? So when people are judging, we feel as though they feel as though they know better, and we kind of internally rail against that. We don't like that the other person thinks that they know better than us. Even if they do know better than us, we don't like the idea that they're putting themselves in the one-up position. So negative judgment, which we, as adult children of dysfunctional families, negative judgment becomes something that is so problematic that we struggle with it. We struggle with our own negative judgment of ourselves. We struggle with our own negative judgment of others, and we struggle with other people's negative judgment of us.
Right.
Mm-hmm. Is that something that you see in your practice a lot?
Of course, many of the couples, especially that I have, the way they are judgmental towards each other, right? It's a learning process. It's a concept that they internalize because they have been judged, all their life. So that's how they know how to communicate with each other.
Right.
So I see many couples do that. I see individuals that they come to see me, and because they have been judged all their lives, now they are their own worst enemies.
Mm-hmm.
We see that so many self-sabotaging behavior that's happening as a result of a judgmental attitude that one has towards himself or herself and to the world.
Yes.
So it is part of what they see, and they don't know that it's judgment that they're doing,
mm-hmm.
but they know that they are unhappy and they are struggling.
Right.
So when we open it up and we talk to them about, judgment and how they are reflecting negatively about themselves in many areas, right?
Mm-hmm.
First, there is a, kind of denial process. No, that's not true, but how else would you think, so they just don't know another way of thinking about themselves and about the world.
Mm-hmm.
But when we go deeper, we realize, and these are the adult child of parents who have raised them by negative feelings and negative emotions and negative behavior, and obviously all of that falls under the category of judgmental parents.
Right.
In the name of good, in the name of teaching importance of life, based on parental experiences, right? And then negative emotions that have been imposed on them, and they have lived by those rules, right? These people, these current adult childs, they come here and they just don't know why they are struggling so much.
Yes.
And then imagine that, when two people who form a couple and then they are in a marriage or a relationship, and, each come from a background with negative emotions and judgmental attitude and feeling negative about themselves, how they project those negativity to each other.
Right. Exactly. And so judgment comes from emotional immaturity.
Yes.
Okay. What does that mean? That means that when we are young, when we're 1 year old, when we're 2 years old, when we're 3 years old, we see the world very simplistically. Other people, starting with our caretakers, our parents, from our point of view at 1 or 2 or 3 years old, they make us feel good or they make us feel bad. And so that's the beginning of judgmental thinking, is you make me feel this way. You make me feel good or bad. We don't recognize that we are doing it because we're incapable of recognizing it at that age. We don't have that part of our brain developed. So what happens then is we start thinking of the world in terms of black and white.
And one other reason is that, parents usually don't know how to teach children to express their feelings, but they focus on the behavior and action.
Correct.
Right.
Correct. Exactly. So why the child is behaving the way they are becomes something that is overlooked. And since it's overlooked, the child doesn't learn to ask themselves, why am I feeling this way? All the child does is repeat what has been done to him or her, which is to judge the behavior as good or bad. So what happens all the time then is the child learns to do the good behaviors in front of others, but also many times feels internally like a fraud because they have these negative feelings and they know that they're doing this just to please the other person and they're not happy with that. So black and white thinking is probably the single most powerful thing that gets in the way of recovery. Because I want things to be simple. I don't want to have to really think about it too much. And I don't trust that I can think about it too much and come to a conclusion that is right for me, even if it isn't right for John over here or Susie over here. So I want to fit in with everyone else. And if everyone else is saying this is wrong, then I'm going to go along with it, even though internally it doesn't feel wrong to me, or vice versa. So black and white thinking, I think, is probably the single most powerful thing that we need to address when we go into a counseling situation with someone, because when they think about that, they stop being curious about what's going on underneath their behavior.
So let's do more of this explanation after our commercial break.
After our commercial break, we will see you back shortly.
See you shortly.
Are you there?
Welcome back from our commercial break. Dr. Mitra and Dr. Robert here at Heart-to-Heart program at KMET 1490 AM ABC News Radio. If you're just tuning in with us, our discussion is about, codependency and how that, controls our life. Please call us and share your ideas, 951-922-3532, and also visit us at heart-2-heart.online/YouTube. And please share this program with those that you believe they can benefit from. And we appreciate you giving us your Friday morning hour.
Absolutely.
So, Dr. Jaffe, we were talking about the black and white aspect of codependency.
Yeah, so what I was saying before is that part of recovery from any addiction, which includes codependency, is is beginning to realize that we have some emotional growing up to do. And because a lot of times we are raised in a judgmental environment, we don't want to believe that anything was wrong with the way our parents raised us. And we keep our parents on a pedestal. And the keeping of the parent on the pedestal is probably one of the biggest blockers to emotional recovery. As a therapist, I am not here to tell you that your parent was a bad person. But what I am here to do is to help you to understand that your parent was human, just like you are, just like I am, and your parent may have done things that they may have believed was right, or may have thought that they were helping, when in fact they were doing the opposite. And so when you keep your parent on a pedestal, what you do is you say, anything that they said or did was in my best interest, and therefore I'm not going to refute that. Even though internally I don't like it, I think that my parent was right. And I have had many people in my practice, and I'm sure you have too, where we have had where the parent has really been hurtful to the child, sometimes physically, sometimes sexually, most often emotionally, has said horrendous things to the child, like "I wish you were never born." And the child says, yeah, but, and then they would give the but. Yeah, but she was just upset when she said that. Yeah, but she had 3 kids to raise, or 5 kids, or 10 kids to raise, and she was overwhelmed. And so what they do is they try and discount the impact of that happened on them in order to keep the parent on the pedestal. And they feel as though they need to keep the parent on the pedestal because they need to believe that the parent knew best. And by doing that, they take themselves out of the picture because the parent doesn't know best all the time what you need. Even in functional families, even in loving families, the parent can only make a guess as to what it is you need. And sometimes the parent is going to guess wrong. But in a functional family, the parent recognizes that they're not always right and doesn't defend themselves when they're wrong. They say, "Oh, I was wrong here. I didn't understand," or "Oh, I gave you this when you really needed this, and I'm sorry." And so the parent then takes themselves off the pedestal by allowing that they make mistakes and they're imperfect, which then allows the child not only to take the parent off the pedestal, but also to admit when they are wrong. And so a person who cannot admit when they are wrong or made a mistake is a person who is still very, very injured from their childhood.
That's true.
Yeah.
I remember when I was raising my daughter, there were times that, I was struggling about how to proceed with the next step. But I felt I was honest with my daughter for the most part about how my experience looked like. I used to tell her, but I haven't been a teenage mom before.
Right.
So I'm learning as you're growing up.
Yes, good.
Just the other day, I told her that, I've never been, and what do you call it, a mother-in-law before. So I'm learning how to do that, how to make that adjustment with her now being a married, woman, and, she has her own life, and, she has her own style of managing, her marriage. And I just need to learn how to adjust with that.
Right.
And this is really how it is, unless we have more than one child, so that will give us more experience. But for me, having one child, I'm learning as I'm aging and as she's growing up and as she's making progress and as I'm making progress.
Exactly. Yeah. And so again, by admitting that you don't know, you're giving her permission to not know. Right. And so a lot of what we do in life is we experiment.
Right.
We say, "Oh, I think this is how I'm going to act," or "This is the way I'm going to think about this," or "This is the way I'm going to approach this." And then we try it, and it works, and we go, "Oh, okay." Or it doesn't work, and you go, "Oh, okay, it didn't work. So what else can I do?"
Exactly.
Right.
Yeah.
But if you're committed to being right, then you cannot really take in what other people think, say, or feel.
Exactly. Yeah. If I feel like I know it all and I'm always right and everybody else is wrong, I'm just shutting down my personal growth process.
Yes. And then in recovery, there are different levels that people encounter as they go through the healing process. And the first level, you can just call level 1. Level 1 is mostly about behavior. And level 1 in codependency recovery is focused on the relationship that you're currently in. So, why won't he empty the trash? I've asked him a dozen times, and he keeps forgetting to empty the trash. And then when I remind him, he says, "Yeah, I'll do it tomorrow." Why can't I get him to listen? And so that's the first level where people start recognizing, "Oh, this isn't working. There's something wrong." And that at that level, they may then say, okay, at some point, they may say, "Well, this is getting so frustrating. I either want to get a divorce or I want to get into therapy." So they get so if they don't get a divorce and they get into therapy, then they come in and they start complaining about each other, right? And that's level 1. And level 1 means that you're in a relationship, but your eyes are focused outward. Your eyes are still not focused on you, what your part is in it. I'm not doing anything wrong. I'm simply asking that he remove the trash. Take the trash out. What's wrong with that?
Right. And I've seen many of those couples that they just don't look at themselves, but they point their fingers at the other one and blame the other one and have expectations from the other one.
Right. Right. So, um, and so what I say is, okay, well, that's your perception. You have a particular perception that all you're doing is asking him to empty the trash. So then he's sitting there, and I turn to him and I say, "What's your perception?" And his perception is, well, there's a lot of times I do empty the trash, and the couple of times that I forget, she's on me, and I just don't like it. So now he's giving his perception. Now at that point, she can argue with him, and oftentimes that's what happens.
Right.
Right? Or she can say, well, I don't really see that that's happening. I don't see that you're emptying the trash most of the time. And he says, well, you're not around. He says, I do. He says, but you don't see it. But he says, but I can't. I says, but when you ask me to empty the trash, you have that tone in your voice.
And that's the thing. That's a laser beam that causes so many emotional injuries, and we don't realize it because we can't see it.
Right. Right.
But we feel it. It's just like laser. It cuts through a person's emotions.
Exactly. Exactly. Yeah. So that's level 1 recovery work.
And how painful that is, of course.
Yes. And then level 2 work is the recognition that, hey, there's actually something else going on here besides what's on the surface, that I'm asking him to empty the trash and he isn't. And level 2 begins with recognizing the tone that she's asking, and also begins with him recognizing that because he has felt like he's being henpecked, that he has developed some resentment. And so he then acts out the resentment by procrastinating, by emptying the trash. And then, but that involves him taking a look at himself to recognize that he's actually carrying that resentment, rather than saying, well, I do it, but you don't notice it, because that's still level 1.
Right.
Right.
Exactly.
And then the deeper that we go into understanding what's really going on inside of the person, the deeper the person, the deeper the awareness becomes of not only what is happening, but what's happening behind the scenes. And when we go to level 3, then we begin to look at the transference that's happening, because we all had people who raised us, and we all learned things from them, some of which we're carrying into our current relationship. Our beliefs about how the other person should behave.
Right.
Right? And so when the other person behaves differently than our mom or dad did, and we still have our parents on the pedestal, then we don't like it. But we're not aware that it comes from our parents, and that we're following blindly our parents.
Yes, exactly.
Right?
Right. And to come to that level, of course, nobody can do it on their own. And that's why, psychotherapy is recommended, to make to facilitate that, understanding of ourselves, and recognizing that how we are following a path in life that was designed for us versus us actually designing it for ourselves.
Correct. So what psychotherapy is about, it's not about telling the person what to do. Right? It's about helping the person understand themselves and the forces that have affected them, so that they can make their own decision and live with the decision that they make until and unless they find out that that decision is not a good one. Right?
I see, my clients sometimes when they come here, and initially they say, well, tell me what to do. And I said, I can help you understand yourself and what makes you do the things that you do. And they say, but that's not what I'm here for.
Right. Yeah.
But, realistically, we can't tell anybody what to do.
Right. And the only time that rule is not an established rule as therapists is if the person is engaged in a behavior that is physically dangerous to them.
Right, exactly.
Then we may say, well, if this guy is hitting you, you need to separate.
You need to separate, yes.
Yeah. But in most cases, it isn't that. In most cases, it's a psychological dynamic that the person is caught in, and the person is usually not looking at how they're thinking and what they're doing to create it.
Exactly.
We are co-creators, and that's what I try to help people understand, is that we are creators, not victims. Right, as adults.
Yeah. Yes.
So, given that,
I like what you said, because we recreate what we learned in different contexts.
Right.
So fundamentally, we are following the same path, the same blueprint, but each time the context is different.
Exactly.
Right.
Or sometimes we have such an aversion to the way our parents did it that we don't think about it, we just do the opposite.
Right.
And the opposite is not necessarily our authentic true self either, right? So it's a reaction to our parents. So we're still dependent on the way they were to the way that we behave, right? So what we're trying to do is help you understand what's right for you, independent, and it may be exactly what your parent chose. It may be the opposite of what your parent chose, or it may be something totally different than what your parent chose.
Yes.
Yes.
That's true. Yes.
So, and then that when that happens and you can choose for yourself, then you're not in a codependent reality where you're wanting the other person to always approve of you, and if they're not, then you're miserable.
Exactly. We just got our signal that our program is over, and this is a fascinating topic that definitely we will follow with it next week. And I would like to invite you to please join us again next Thursday at 3 p.m. for another episode of Human Sexuality and Relationships, and the following Friday for another episode of Trauma, Addictions, Codependency, and Relationship as well. And until then, don't forget that all you need is love.
All you need is love. Have a great weekend.
Bye-bye.
Bye-bye.